So this year, we definitely took to heart what was going on with the government, and really wanted to look at, figure out how at the Consumer Electronics Show can we look at the Affordable Care Act, and how what opportunities lie. Not only what is being developed in accordance with these new demands and new mandates, but what opportunities are there out there? Now, we know it's been slightly some rocky rollout of some things. We don't need to get into that. But we're really excited. So we created these 3 sessions, and we looked at the very strongest prongs that we thought there were major opportunities for you all in looking not only at the products that you have, but potentially also at the products you might create. So we're going to start, I'm going to start by introducing Paul Slavin, who is the Chief Operating Officer at Everyday Health. And like I said, we're doing great fun mottos to live by. And his, I won't say it completely, but his is, don't F it up. I think that might be mine. I'd like to welcome, thanks.
That's a very media motto. So, good morning. It's great to see everyone here today for a discussion on the empowered consumer and the Affordable Care Act. Life used to be easier, at least for me. I believed that there was one universe, that the bachelor would not marry the bachelorette, and that my mother loved me. I also felt that consumers in the healthcare space had very little control over their lives. None of that appears to be true. We're here today to talk about that, to talk about the changes that the Affordable Care Act has really instigated amongst consumers, and how that's impacting technology and how that's impacting companies. The Affordable Care Act is truly a revolution. I've spent a lot of time reading that bill, and it is massive, and it is massively impactful on everything, on everyone. It will have challenges and changes that are just going to ripple through our economy in ways that we just don't quite understand. One of its stated goals is to advance the health, safety, and well-being of the American people. That's a goal we can all get behind. At Everyday Health, it's what we do every day. These companies here, it's also what they do every day. As a digital health publisher, Everyday Health, our success hinges on meaningful engagement. We know that we drive better health outcomes by engaging our consumers and connecting them with the content and the functionality and the tools that they most need. All of us here today have a role to play in making people healthier. Whether we're tech companies, pharmaceutical manufacturers, health insurance companies, publishers, or providers, we all have the same responsibility, and that is to our consumers, to help them live healthier lives and to do it in a way that they can afford and society can afford. As you know, it's been a tumultuous few months since the ACA came into existence. However you feel about it, there's no denying that, as I said, this is truly a revolution. It's a revolution that's touching everyone: providers, payers, consumers. Providers are going to be rewarded for making people healthier, not for creating tests, not for putting people through a battery of things which may or may not be useful. They're now going to be rewarded by making people healthier. And they're encouraged to coordinate and share that information through the Accountable Care Organization. And that's going to help reduce healthcare costs and improve results. Payers have to cover more preventative services and essential health benefits. They have to adhere to new restrictions. They can't turn people down, for instance, for pre-existing conditions. No annual lifetime limits on coverage. And consumers, well, millions of consumers are now entering the healthcare system with health insurance. They're going to have access to more information, and they're going to be expected to help manage that information and manage their own care. This morning, our panel will explore opportunities for the digital health industry in the face of this revolution. How do we help newly empowered consumers navigate their healthcare options? How can we leverage digital technologies to help people stay well and make better choices? And from a business perspective, how do we make the most of the opportunity while providing value for consumers and patients? Joining us today are Bettina Experton, did I do that right? Good. Of Humetrix, Lisa Maki, the CEO of PokitDok, and Tom Paul, Chief Consumer Officer of UnitedHealthcare. We're going to just sit and we're going to talk. I'll ask some questions to get the conversation going if necessary, but before we do that, each of them is going to have something to say, 3-4 minutes. Oops, sorry about that. And if you guys feel like you have questions, don't hesitate to interrupt, except not when they're speaking. And I'll give you an opportunity later on also to ask questions. Thanks.
Thank you.
Oops, sorry.
Good morning. It's a pleasure to be with you, and at this particular time where we are transforming healthcare and us as consumers. And I think we are benefiting of extraordinary national policies. So Paul talked about the Affordable Care Act, but preceding that was a High-Tech Act, which set the stage for bringing this healthcare system of ours to the digital age. But to start with, the consumer was out of the loop with regard to information. And if we can bring the next slide, unless I can shift it. Yes. So with the High-Tech Act, which was pouring $30 billion into healthcare IT to bring providers to the digital age, in 2009, there were only 10% of physicians using EMR, 14% of hospitals were using EMR. So here we are at the end of 2013, over 50% of physicians and 80% of hospitals are now coming to the digital age. However, only 1/3 of them can exchange information among themselves so that at any point of time, a patient accessing care can have his full history in the hand of his physician. And when you look at, for instance, the Medicare population, on average, it's surprising to know that a Medicare beneficiary is seeing 7 different physicians in a given year. So if indeed only 1/3 of our physicians can exchange health information among themselves, we still have issues of accessing that critical information to deliver the right care, the right price, and ensure patient safety all along the way. And when we talk about those big trends in healthcare IT, big data, our payment reform with ACOs, all of that relied on the fact that the data, the information is there to capture that event which took place outside that ACO system, to do those right analytics to provide the right care. And for that, the patient needs to be engaged, the patient needs to contribute his own information, the patient needs to be in control. Next slide, please. So about 3 weeks ago, the Wall Street Journal had a story portraying our technology called iBlue Button. But in a striking way, Melinda Beck, the author of that story, brought up, I think, a transformating happening in terms of policy making. When Dr. Farzad Mostashari, here picture on this story, was sharing, starting in late 2012, his own personal story in accessing information, health record for his dad, through the Medicare Blue Button record. I will come to it in an instant. And using our technology, but using a mobile device, and a device everyone has his own pocket, a smartphone, was able to access his father's health history, who visiting him at Thanksgiving needed emergency care, and all of a sudden, Dr. Mostashari experienced the power of having your own information or that of your loved one, so that you can share that information to the physician for the right care to be delivered. So that personal experience of a policy leader in Washington has, to a degree, shifted that policy making. And another transforming happening attached to the Affordable Care Act in September 2013 took place, and that's the new HIPAA rule. Under the new HIPAA, consumers, all of us Americans, have a right, a legal right, to electronically access our health records. This is absolutely transformative. Now that indeed there is an EMR infrastructure in place, with over 50% of physicians using EMR, and that number growing steadily, We have now an infrastructure to be able to exercise that legal right and access our record to review them and share them with our physician. And another powerful trend, I think, converged to make this transformative happening in the hands of consumers. We all have this smart mobile device in our hand. Worldwide, 5 million cell phones are in use. So the computing power in terms of healthcare IT is indeed in the consumer hands to solve the interoperability issue we have, to solve the silos in terms of data access we have, and to deliver that safe, cost-effective care. So I mentioned Blue Button. Blue Button is also part of that transformative policy and national policy which took place in the last couple of years. Blue Button was a federal initiative, is a federal initiative, which is centered around consumer engagement. It's about giving all of us easy access to our online health records. And when you see this logo on a patient portal, this means that you can click on it and download your records on your device, whether it's your desktop at home, but more relevant, on your smartphone when you need to access that critical information and share that with your physician. So initiated by the VA, by CMS for Medicare, and by DoD for TRICARE covered individual, this initiative now has been embraced by over 500 organizations, public and private, nationwide. And as a total, more than 100 million Americans can access their online record using Blue Button. And then the federal government reached out to industry to innovate around that policy. And that is when I think this convergence of mobile technology and those transformative policy can truly make a critical difference. And we came with this mobile app called iBlue Button, which won several awards of innovation competition launched by the federal government, to make use of that Blue Button information, for instance, for Medicare. And that's the information Dr. Mostashari was able to access on his smartphone for his dad, directly accessing that Blue Button record, which our app, iBlue Button, transform in real time on board the phone to present for the patient and their physician a health history, a comprehensive history of the last 3 years with a medication list, previous encounters, etc. But the most important thing, I think, for all of us and for me as a physician entrepreneur is that with such technology and those policies, we can ensure that critical patient safety and put that tool, that information in the hands of patients, their caregiver, so that no harm is done because the information is not there. It's striking to know that over 200,000 deaths, which can be prevented each year, are mainly due to the fact that at a given time, a physician doesn't have the complete view of the patient is treating at that time. 200,000 preventable deaths and 2 million injuries a year. This is something we need to change. This is something we need to change with our own capacity now and our legal right to access our own records on our mobile device anytime and anywhere. So I think this is an exciting new year coming to us thanks to those national policies. Paul, sorry to go a little bit over the time.
Come on over.
Thank you so much.
Lisa?
Okay, I'll stay here. Thank you to Paul and Bettina for laying the groundwork. So it'll make it very easy for me to explain what PokitDok does. In the environment of transition that they've discussed, we see two simple things. What we saw at PokitDok: consumer out-of-pocket expenses going up and reimbursement rates for providers going down. These two groups are seeking each other. In any other industry, and my co-founder and I have been making software for a long time, that would describe a marketplace, those two groups seeking each other. So we thought, what if we built that marketplace? And that's PokitDok. It's an open health marketplace connecting consumers directly to providers to shop for non-acute care. Anything from primary care to mammogram, MRI, to flu shot, even a shoulder replacement. Anything that's predictable, plannable, can be priced and sold in a marketplace. And that's not just cash or insurance. So marketplace, two sides, buyers and sellers. For providers, how do we connect them in? We realized we had to build all the fundamentals. So we gave them a super simple way, a free profile, even a website to get their practice information, treatments and services published into the marketplace. That's available to any health provider out there today. We have over 3 million provider profiles in PokitDok today of both medical and holistic providers in the nation. You can just go in for free and claim your page and immediately publish your information into the market. The consumers can then shop from those profiles and even request a cash quote directly from the provider to understand how much they want to sell that procedure for today. We don't broker prices, we don't pre-negotiate. These are today's prices, not last year's claims. And but that's not enough. We realized at PokitDok it wasn't enough to know the cash price. You also need to know how to compare it against your expected out-of-pocket if you were to use insurance, especially as so many more of us are going to be covered this year under the ACA. So we said, we're going to build out, this will mean something to you, we're going to build out what's called an X12 stack. And for those of you who don't know what that is, that's what allows us to check eligibility, tell you how much your deductible, what progress you've made against your deductible, and then we present it to you in a simple way so you can say, all right, what's the better value? This provider's telling me if I pay today with my HSA or my credit card, I can get money off and it goes money directly into their pocket, or is it a better value to do my insurance based on where I am with my deductible? So that was the empowerment piece that we introduced into PokitDok. It doesn't matter what plan you have. We're building trading partner relationships with many payers, including United and Blues and Regional, and adding more every day. And our primary purpose is to connect those two groups and simplify and reduce the cost of the business of health. So hopefully those savings can go into the consumer's pocket or the provider's pocket. We make money by licensing it to payers as for their members, as well as to self-insured employers so they can use it as a tool for their employees to buy higher value care. Thanks very much.
Thank you. Tom?
Thanks, and again, appreciate the setup. I'm going to repeat much of what has already been said, but give it in a perspective of from UnitedHealthcare. Thought I'd start a little bit about telling you about UnitedHealthcare, a bit from the consumer perspective, because I think our experience with the consumer population in health, the transformation we're seeing as a result of the ACA actually was preceded by what we were seeing already in a very strong consumer movement in an environment where out-of-pocket costs by the consumer continue to rise, but perceived value for that out-of-pocket cost and actual outcome for that out-of-pocket cost continue to diminish from their perspective. Our view is from a very holistic consumer perspective. We're an organization that provides health benefits and services to over 40 million individuals across the United States and in other countries as well. Our range of age, our youngest member is probably minutes old. We have over 800 births a day coming into UnitedHealthcare. Our oldest member is 113 and will age into 114 in April of this year. So we have quite a variety within there. I think another interesting fact is that we have over 17,000 individuals over the age of 100 that we currently serve. So it's quite a variety, and we're serving those individuals under a multitude of payer systems. So whether it be in relationships through employers, both self-funded and fully insured, whether it be through Medicare and working with the federal government, Medicaid working with the state governments, and the military working with government as well, the Defense Department, have a wide variety of experience of how the payer systems impact those consumer relationships and what they're needing and what they're asking for. And in general, what we're striving to do is get a better balance between that out-of-pocket cost and the value that is achieved through that. We think that the changes that are happening in this marketplace transformation right now are really shifting that and the demand of the consumer in the overall health experience. So that it changes from a better experience that is probably more akin to what you might find in the financial or in the retail industry. The ACA kind of pushed along that shopping experience, although the Medicare space has been there for many years. And now it's moving that, once we get through that shopping experience, we'll move to that actual health realization experience. The second component around the experience is really just the leveraging of data and information, both that which is generated from the experience that the consumer has in the health space, but that the consumer tells us even outside of that health space, so that that data can be harnessed in such a way that becomes more intuitive, more personal, and more supportive of a consumer in making their decisions, hence the empowerment of that consumer. And finally, getting to that realized value, so that as individuals can get that better health outcome from the experience they're having. Traditionally, the health experience most realized by consumers often started when they were faced with an event, whether it be as simple as I'm getting high blood pressure or a high cholesterol, or it's a diagnosis of cancer. And that's often the person's first realization when they start needing that empowerment to get through that health experience. What we're seeing is a dramatic shift in that transformation and moving more into the health and wellness, so that we get more into that preventative part of the health world, which is what we need to do to get to that greater balance between the cost and the value perspective. And so UnitedHealthcare is really focused on those areas and driving that further engagement. We don't think that can be accomplished without the inclusion of a digital relationship. And that is where we're relying on us to be able to respond to an individual where, when, and how they want to be responded to or interacted with. And with the transformation and relationships that now occur in your hand on a device or on your wrist or strapped on your chest, that's where we need to be able to move that relationship as well, which is where digital and technology really play an important role for us.
So could you be a little more specific about the tools that you're interested in for empowering consumers?
Sure. I'll give you a couple great examples. I think part of the confusion that has existed and part of that value chain discrepancy has really been about the transparency of pricing within the health industry. And so I think you're seeing a number of organizations, including United, who are introducing to the marketplace tools that help address that transparency issue around pricing, but also the transparency around the value that you get for that price. I'll give you a couple great examples. We have a tool called Treatment Cost Estimator that allows you to search for a doctor or a health service, identify by the doctor, the quality ratings that exist by that doctor, the cost of that service based on a contracted rate that we would have with that physician. So it's based on the actual contract. And then for you to identify and choose how that fits then within your benefits, so that all of that becomes integrated with your actual benefit experience, so that it becomes that more holistic kind of financial transparency that you can achieve from that. We've taken it one step further. We recently announced My Easy Book, which is really an online application, an online marketplace where you can not only find a doc, find the quality, but you can actually book the appointment. And with that booking of the appointment, you can prepay for the services, so that you can then go in and focus on the actual procedure or the service rather than the business or the financial aspect of that. And what we have found in that process is that because we're also filling a gap on the provider side, because they may have an open appointment tomorrow or the next day, by able to put it into that marketplace, we're closing gaps in a schedule for a physician. As a result, they're willing to give us even further discounts off our contracted rates. And on average, we're dropping that price about 30% off our contracted rate for those procedures for individuals. So those are just two examples of where we're taking that data, putting it in a more easy-to-use, consumer-friendly environment, and then solving problems and value problems that existed.
So all three of you really are redefining what engagement with the consumer is in this particular marketplace. Lisa, talk about that a little bit. What do you see that's going to be different? How is the ACA going to change that? Where do you see that going into the future? I mean, it freaks a lot of people out that they're going to have to do this for themselves. I mean, they've lived a long time being told this is what's going to happen to you, or submit your claim form and we'll take care of everything else. There's not only an expectation that companies are going to be engaging, but consumers have to engage. So how do you see that?
Right, the consumers will have to engage and providers will have to engage differently. A lot of times I describe it as when healthcare was essentially, we experienced it as free, pre-ACA, we were willing to accept a lot because we didn't have to pay for it. Now that we have to pay for it, we expect to be marketed to, we expect to understand the value, we expect to feel like an opportunity for whoever's service we're about to buy. You have to win my dollar. That's never existed in health before. So that puts a burden also on the provider. It's why we put so much effort into giving them marketing tools as part of their profile to help them bridge that gap from where they are today, where they really aren't having to market themselves at all to consumers. Now you do. Now you have to, what is my value? Why? Because we're not about discount pricing at PokitDok. We want to know, why are you the price that you are? Why? Because every other industry has varying prices for varying levels of service, type of product. I just want to know, why is yours better? Why does it cost more? Tell me that. Make me feel like an opportunity and win my dollar. That's a completely different way of shopping for health that we haven't experienced before.
And how do you ensure the quality of that information?
So I don't ensure that the quality coming from the provider that they put into the marketplace. I let the market, like in any other industry, drive consumers' experience and what they tell each other about their experience with that provider. In every industry, if a provider is telling you one thing and you go and you experience something completely different, then it doesn't take too long for the marketplace to learn that disparity. And for that person, either they have to start delivering at the level that they're communicating, or they're out of the market.
Again, though, it is beginning, increasingly we are asking consumers to take a real strong role in their own health care.
Yeah.
And that is a huge shift. I wonder, have any of you had any experience with consumers we've all had experience with consumers, but do you think that they're going to adapt to this, that they'll have no choice to adapt to this? How do you think it'll be received ultimately?
I think when we talked about the human cost as well as the healthcare cost, I think consumers come to the realization that being engaged, being informed, accessing their own information, reviewing it, making sure that tests and procedures are not repeated, they are not redundant, that the physician who treat them has the full information so that the wrong prescription is not prescribed on top of a set of medication that patient is already on and the physician didn't know about it. Overall, about 30% of healthcare expenditure are wasted because of medical error, because of redundant tests and procedures. If we have over 300 million set of eyes to look at that information which concern us or our loved one and ensure that indeed there is no error in that medical record, that we can accurately communicate to our physician what is critically important for him to know to properly diagnose and treat, we can address tremendous cost and this human factor of being medically harmed by the wrong procedures, by the wrong medication. About 1/3 of hospital readmission of Medicare beneficiary, for instance, are caused by what we call polypharmacy issues, because drugs interact with each other, because at one point one drug was prescribed when the physician didn't know what other drugs this patient was on. So this engagement of consumers, of their caregivers, and in having access, for instance, which is critically important to their health records wherever they are, and be able to communicate that information to their physician, can address both that human cost of that medical errors, which can be at times a matter of life and death, and also those huge amount of waste and unnecessary costs which plague that system.
So, Tom, your organization, your company, huge company, has always engaged consumer after a fashion. Do you look at this kind of engagement as substantively different or just an extension of what you've already been doing?
I think it is an extension of what we're doing, but again, I think what we're seeing is really that shift in the level of engagement of a consumer. I mean, I was responding to your previous question about whether this is new, and I step back and think, well, how can consumers not be involved in their health? And how could this be a transformation? But I do think, again, not talking about all consumers, that they're all acting the same way, but in the past, traditionally, consumers placed a high level of trust in other individuals to really define much of their health future. Their physician told them they needed this treatment, and they often complied with that treatment. A condition happens, and they now have to deal with it. You can't just ignore the fact that you have high blood pressure or ignore the fact that you've just suffered a heart attack. And so I think there's always been that level of engagement, but I think now consumers are going to play a much more active role in owning. It's going to move beyond engagement, and they're going to own their health outcome. And they're going to define it, because I think the level of information and the level of data that they have is going to transform the way they interact. And I think a little bit of the cause of that is the out-of-pocket expense that they're going to incur as a result of doing it. I think it's also going to transform the way the timelines, again, as I spoke earlier, of where we realize health, because for the most part, health has been realized at the point of an issue. And now it's going to be more around preventative. If you go through the digital health space, you can't stop but be amazed about all the monitoring and tracking and activity devices that exist for us and how they're becoming integrated as a part of our life, whether it be walking, sleeping, blood pressure, blood oxygen levels, et cetera. It's all going to be a part of that day-to-day way in which we monitor what we do. And I think that's a good tradition, or a good move to the old traditional way, because it'll engage people at an earlier stage in their health, which will get us more to that preventative space in health.
So I don't want to underestimate the intelligence of the public, but we've been talking to them about obesity. We've been talking to them about any number of health issues, and a relatively small percentage of them pay any attention. What makes the three of you think that any of these technologies, these new engagement tools, even the ACA, what makes us think that the public is really going to adapt to this and is really going to change things? Because I think you would all agree that there's no question this could have dramatic implications for people's health, but also it could significantly reduce the cost of healthcare, which is good for everybody.
We've got to pay for it. That's the biggest change that has happened with the ACA, is we're paying for more of our care. I mean, whether right or wrong, culturally, we don't tend to change our behavior unless we have some skin in the game. And once we do, we demand more. We demand the things you would expect from any other industry: more service, more information. We take more responsibility over how we spend our dollars and what outcomes we get. To me, that's been a major shift, because 5 years ago was too soon for this. We didn't see the behavior shift then. But with increasing out-of-pocket expenses, I totally agree with you on that. That is what has been motivating the change in the public behavior.
And I think the second thing, I fully agree that that's going to be the primary driver is around that cost. But I think also in the world of healthcare, dealing with health, whether it be treatment or whatever it might be, used to be a separate, discrete event. And now we can actually make it a part of day-to-day activity. So that it's not this side event that you have to pay attention to or work through, but you can actually make it a part of what you do on a day-to-day basis. So it's easier. It's not something that you have to stop and think about or readjust your schedule around. It now can be a part of your day-to-day living. Congestive heart failure is a great example where probably one of the best indicators about whether or not you're controlling your congestive heart failure is changes in your weight, because the more you retain fluids, the more weight you're going to be showing or be on the scale. Digital technology now allows you in the morning to get on a scale and transmit to your doctor your weight on a daily basis, and your doctor then can determine whether or not an interaction is necessary or a call is necessary. So it's not something where I now have to stop, get time off of work to go in and see my doctor. I actually just step on the scale in the morning and I've accomplished the same thing. And so we're making it easier for people to actually get that health outcome that they're looking to achieve.
I think people, become engaged when this striking personal history come into play, either for you or your loved one. We don't think about our health until disease and pain comes into play, when this event come into our lives. And it's true when you look at healthcare costs as well. 1% of the population incur 20% of the cost, or over 50% of the cost are incurred by 5% of us. Those are the sick, the chronically ill, as caregivers of elderly parents, we are concerned about that chronic disease affecting our parents, and we are more likely to be engaged, to access information, to educate ourselves, to share that information when needed. I'm a preventive medicine physician and public health physician. It's hard to motivate the young and the fit, and the young and the fit, which is going to measure its calorie intake and its steps and being more fit, and is not going to make a striking difference in our healthcare system today. But that chronically ill with multiple chronic conditions, reaching a certain age and multiple medication, need to be engaged, need to be informed, and I think that's the population we need to attract and inform that now they have a right, they can access their health records. They should review them because they can cause medical errors if they don't review the accuracy of those records. They have to be effective communicators. Sorry. So I think engagement comes when a need strikes, and it is for that chronically ill or for that parent of ours we worry about. And it does happen, and now we have legal rights, we have an infrastructure, we have mobile device where the information is available at the tap of an app, and this is going to change everything.
So before I open it up to questions, one elephant in the room is data sharing, data privacy. Personally, I think it's something that concerns us in the media more than it concerns most Americans, but the three of you, what's your feeling about that? Why don't you start, Tom? Or sorry.
Go ahead.
Lisa looked like she was ready to go. Go.
Well, I'm glad you brought that up, because what I wanted to agree with you on your second point, which, and here we are at CES, so we should talk about the fact of how much data is now being collected and what are we going to do with it, and how we're collecting it, and to your point, are we doing it safely, securely? And to answer and to speak to Bettina's point, by collecting all that new data, we're actually, and this ties the two together, the events that motivate the action by the consumer to get involved are becoming much more frequent and earlier on in the health process. But you nailed it. Now, the next super interesting problem to solve, I don't see it so much as we should not hold back in any way, but the interesting problems to solve, at least for us as technologists, are now, at least at PokitDok, having built out this basic layer of the business of health, how do we start connecting in all this new data in interesting and impactful ways that can personalize and bring that moment, that event? You don't have to wait for the big, scary event. You can have the small, healthful event early on that's more personalized to get people involved. And I think consumers are much more willing to opt in and share data for that purpose. Then we're thinking about it now, maybe from a HIPAA standpoint, scared to share that data and to use it effectively.
Yeah, and I think part of the key to that is really just a recognition that it's a requirement, it's a must, but it's not an obstacle. It can't be the barrier that prevents us from getting to that empowered consumer. The financial industry figured it out. They found a way to be integrated and open environment around data. Where it can be protective and owned by the consumer and the individual. So it can't be a barrier for us, it's got to be something that is a must.
And I think that's one more area where the patient, the consumer, can play a critical role. I mean, to contribute that data, that personal information, you need to indeed opt in and agree and consent to the sharing of that information. So you need to have access to that information. It needs to come to you. You need to be able to review, understand it, and then understanding that you will benefit from the collective good of contributing your data to, in return, receive more personalized care. Then the patient is more likely, the consumer is more likely to, controlling that own data, to contribute that data in a transparent way. So I think it goes all in hand. When you talk about big data and analytics, the patient needs to be center stage, need to have access to that data in control, and agree to consent to share that information to the collective good, to benefit in return from more personalized care.
So I'd like to open it up to the floor if you all have any questions. I don't know how we do this, though. Is there a mic for people, or do I just point? All right. This guy here is not looking. Yes. Go ahead. You. Yes. Oh. There's no mic, so just speak loudly.
I'm from Taiwan, and in Chinese say that the best doctor is to treat the healthy people. And the doctor treat the sick patient easily. So you are the best doctor. All member here is the best doctor. You are treating with the best people. But I will ask Tom, you have 40-some million members. How many of your members have their healthcare record bring with you?
Say the last part again?
And you have 40-some million members
Yes.
in your company. How many of them have their health record they can bring with him or with her around the world?
Portable healthcare.
Yeah.
Multiple health records.
Yeah. How many of your members have their record?
So
Bring with them when they travel around the world.
I can't talk about how many actually bring it
How
with
many
them,
percent?
but all of them have access to their health record from United, if that's what you're asking.
Yeah. Yeah, because in my experience, I have 7 hospitals. All Taiwan hospitals have their hospital medical record electronically, and 95% above. And here I heard that from Turing University, Professor Diana, he said only maybe 30-40% of the hospital have this one. So how to rescue Obamacare? I think you better do best work for this kind of the setup of informatics.
Right. Well,
So
and
what's your
again,
opinion?
Yeah, and I'm responding from, again, consumers who have access to the health records as we know them at United. The larger effort is around the electronic medical record and the electronic health record that really encompasses that more holistic view.
In my experience, we provide health promotion to our customer, not patient. They may be have physical checkup in our hospital, or they are discharged patient, but now healthy. We give them active day appointed to them, not they appointed to us.
Yeah, it's
This
interesting.
is personalized health care, but we not charge them, free of charge.
Yeah.
Thank you, sir.
That's it.
Yes, sir.
It seems to me that one of the challenges with the empowered consumer is the empowered managed care provider. And, it's a nice thing to in the past, if the patients kind of happily follow along what they're told to do by their managed care providers, how do we see the collision course that's likely as you become an empowered consumer and you make choices and suddenly it's out of network, or you're being told to do something else, or the money isn't there? It would seem to me that, this is on a collision course at this point, and I would be interested to see what your thoughts are on how we see that context, bundled care payments, managed care, episodic, those kinds of things that have a huge impact on what the consumer is going to think about this.
Well, I can start with that, and you guys can chime in. But if I try to understand what your question was, it's around the empowered consumer and where managed care from a benefits perspective or from a network perspective.
Well, from the provider network perspective, okay, you're the insurer, right?
Yep.
So your mission is to save money. I'm the consumer. Now I know about this. What do I do, and how do I work with you so that we achieve the objectives that we're after? Because it seems that once you empower people, they're better shoppers. Now they may be less tolerant, for example, of some of the policies that may be happening in their managed or bundled care environment.
Yep. So the first clarification is we are about saving money. We are about making it affordable, but the overlying headline is really around better access to care and better access to care and better access to health outcomes in a more affordable way. So I just want to clarify that point. I think part of the empowered consumer, again, getting back to some of the transparency issues, some of the challenges have been within the industry really is around transparency also as to what health insurance provides and what it covers and how it covers it. And a lot of the concern can rise when you may have confusion between what's covered and what's not, what's in network, what's not, and the network relationships that coincide with that. And so that has to become part of that more improved shopping experience and transparent experience as well.
I'll just add onto that is you've hit a truth that in marketplaces, consumers don't do what you want them to do. That's just a fact. I've been making software since 1989, and in every marketplace we've ever introduced technology, that has happened. So I think that there's a lot of opportunity there. You have to start persuading people. You can't tell them what to do. You can't make them do it. In an open marketplace, you have to start persuading them to do what you would like them to do, and that will be a big shift.
And I just want to add one more thing too. There is we're sitting here talking about the empowered consumer. There is actually a very large transformation going on as well, probably driven prior to the ACA, but also informed by the ACA on the provider community as well, to move again from to that more value-based health outcome relationship, which traditionally in the past may have been more of a fee-for-service or unit cost. So you got the transformation of the consumer going on. You also have transformation in the provider or the health professional community going on as well, and those two will come together and collide. And we should, at that point, be a nation who spends money on healthcare and actually gets the health outcomes that we want, because we're not getting them today.
I think with a new type of managed care coming to be with ACOs, physicians have to rely more and more on indeed sharing information with their patients. In ACOs, patients are free to receive care outside that ACO system. For that ACO providers to be able to capture that whole healthcare experience of their patients accessing care outside their system, they have to receive that information from their patients. So that patient-physician interaction and level of communication now we can have with those new policies and tools, I think is going also to enable effective payment reform and better collaboration between patients and physicians.
Yeah, Ray Aller, physician informaticist and journalist from Los Angeles. A question for PokitDocs is, you've described a marketplace, but a marketplace is based on information. Mm-hmm. And by far the most important information a consumer should be using in choosing a provider is outcomes, quality, death rate, complication rate. We don't have those. We might have how long does a patient have to wait in the waiting room, or how to pay, what's the bedside manner like. That's fine.
We don't have much. I mean, I agree with you. We don't have much. We're at the beginnings of collecting a lot of that information and displaying it consistently in a way that consumers can absorb. You're right. And we have to start. You know, we can't wait until it all just miraculously appears and we can put it out there. We have to start, which we are, and collecting that and making it available. But to his point over there, even if we do, consumers will still sometimes care more about whether or not they have parking than how many times they've done the procedure. That's just the way consumers behave, and we kind of have to let it go. You know, we can't make them be I'm a consumer. You can't make me be the way I don't want to be. We aren't all the same. But totally agree, we have to get that data out there in a consistent fashion for people.
We have time for one more question.
So this goes back to your original question regarding data. Data seems to be the holy grail. Everybody wants to touch it. Everyone wants to have access to it. More importantly, everyone wants to monetize it. So one thing I see as a big problem is the what I classify as standardization of data. Everyone's accessing data, everyone's inputting data, but no one has a standard methodology. You mentioned the financial industry, and so I'm trying to get a better understanding of where do we stand in standardization of data.
There are standards out there. Not everybody uses them. Right. And then there are different standards for different types of data that need to be connected. So you have hit on, again, another very fundamental, I think, piece of the evolution of the transition that a lot of us are working on. More of us could be working on together to try to make the the data easier to use, but our approach is we think it's too tall a mountain to climb to try to make everybody standardize. There are ways of addressing the data problem without doing that will still get the data to talk to each other in meaningful and impactful ways for both the consumers and the payers and the providers. So that's the approach that we're taking, is just accepting that all this data is the way it is, trying to clean it up as much as we can, and getting it to talk to each other effectively, to your point.
We do have standards, they are in place, and meaningful use requirement for the use of electronic medical records, ask for physician and to use certified EMRs who can exchange records with their patient and other providers using standardized formats, the CCDA. I mentioned Blue Button. Blue Button come with a standard, and it matches that meaningful use requirement for stage 2. It's the same standard of that CCDA XML record. So that tool like our apps, iBlue Button, can use records coming from different sources, aggregate them in one place for the patient to view and have that holistic picture of their history and share that with their physician. So I think we have all the tools in place. I think it's more a matter of adoption, communication, letting all of us, the public, know that we have those rights, those tools are out there, and providers and payers are adopting those standards to be able to share information as it should.
Sorry to say we're going to have to wrap this up, but that was an amazing, amazing session. Thank you so much, all of you.